The current reimbursement models for antibiotics is one of the major roadblocks for tackling this crisis. We're not getting the drugs we need, principally because we're not paying for them in the right way. However, there are some newer and better methods for doing that. The main downside of our current model of payment is that we pay for volume, so per pill or per injection of antibiotics. This is truly backwards. What the value is to have access to the right antibiotic at the right time. As a corollary, down on the corner, there is a fire station, and we're happy to pay for it while not using it, but we're mightily glad that it's there and for the access to it. We don't pay per fire, we pay to have it there and the access, and that's also the way we should be paying for antibiotics. Our preferred method of payment would be a subscription, just similar to how you pay for Netflix. And really it has several great benefits. First, to the physician, they would not have any kind of cost pressure as to what drug they would use. They would simply look at the patients, the diagnostics, and choose the right drug for this patient based on the science and the disease. Secondly, for the developer of the drug, they would know precisely how much they would get paid, because it would be that subscription that they would get for that drug. And as an investor, which we are, it would be such that the economic equation would really be established beforehand. We would know precisely what that level of reimbursement would be, and we could therefore focus only on finding the very best drugs. We're getting quite close to seeing such subscription models. It's already being piloted in the UK, and we're seeing some highly successful results come out of it. Other countries are also considering it. In particular, the US has in front of Congress today something called the PASTEUR Act, which would enable and create a subscription model for novel antibiotics. So here at Novo Holdings and in the Repair Impact Fund, we're huge fans of the PASTEUR Act. It is really what we need in the US. So if you're watching this video and you live in the US, please write to your representatives to encourage them to please vote for the PASTEUR Act.